My name's Graeme McRae. I have a funny accent because I'm actually by birth Australian. I was working with a large multinational pharmaceutical company in their veterinary business in Australia. I was quite shocked when I came to Canada that I thought I was in the land of the multinationals, and I was quite surprised to see antibiotics being sold pretty openly to farmers without any veterinary intervention or consultation. And that has been a law that was allowed in North America up until just a year or two ago, where antibiotics were finally brought under control. I founded a company. Sole objective in life was to find technologies that might replace some of the use of antibiotics. We have a serious global situation today with a virus. We have a serious global situation today with antibiotic resistance. So children are coming down with infections that just can't be treated with antibiotics. Part of that problem is a lot of these antibiotics have been used without a lot of controls in the treatment of animal disease, and resistance is passed on to humans. So I founded a company, and that company was funded by a group of veterinarians who liked the idea of looking for new, really innovative technologies. In our search, we kept running into the immune system. We realized that chemicals weren't the right answer, and so we kept looking at technologies that would activate the immune system. And that took us into the whole realm of how do vaccines work, and why do some of the most harmful bacteria in the world, such as tuberculosis or the organisms that cause tuberculosis, have such a profound effect on the immune system. So we started exploring certain types of bacteria, and we had to be very careful that we pick bacteria that were not harmful to animals or man or fish or birds. And we finally found evidence of a bacteria that was found in soil. It does not cause disease in animal, man, bird, or fish. And yet it is a close cousin to the bacteria that causes tuberculosis. And that bacteria was interesting to us because if you take the bacteria that causes tuberculosis and you inject it into an animal or a human, then that person or that animal will turn tuberculin positive, even though they don't have tuberculosis, because they have had exposure to that bacteria, you will get a false positive. So believe it or not, this bacteria we found in soil was a bacteria that had the effects within the bacteria that we wanted, the positive effects on stimulating immune response, but it didn't have the downside of being harmful or having that TB positive reaction happen. Started off with very simple experiments, and some of the first ones were in dogs with cancer. Cancer and dogs are synonymous. We have a big issue, similarly to humans. And believe it or not, some of the cancer types are almost identical to the cancers that cause disease in humans. In the late 80s, we were approached by a urologist from a local university in Canada. He was the first urologist in the world to publish on the effect of the bacteria that causes tuberculosis in humans. This gentleman had been working with a colleague who had a dog. The dog had mammary tumors, and we had just had that product approved as a treatment for mammary tumors. After the dog was treated, that urologist took the sample of the empty vial back to his colleague, and that colleague called me and said, "I've got a sample of your product here. Can you tell me if this product is alive or dead?" And I said, "Well, we certainly killed. We break it up into little pieces so the bacteria can't survive the manufacturing process." He said, "And it still works." And I said, "Yes, it really does turn on an immune system." Our ultimate objective was to see if we could treat bacterial infections, which antibiotics are used for. But we started off by the easy pathway, or seemed to be the easy pathway, which is looking at cancer cells, because he was treating cancer in human bladders. We determined that that would be a great way to start. So, and that was in parallel to developing it for veterinary use for other cancers and other indications. Then we had a series of surprises. We happened to have a shareholder, boxer dogs, and boxer dogs tend to, if they're intact females, they tend to come down with mammary tumors. He had history of dealing with mammary tumors in his dogs. So we started to treat his dogs with mammary tumors, and that was really quite astounding as to how, when you inject the tumor with this product, how the tumor would just melt away. would turn into a small volcano and then would just gradually break down. And after the tumor was gone, there would be no scarring. And every time you did some sort of study, you'd end up with more questions than you had answers to. And so one question led to the next question. Why are these tumors breaking down? Why is there no scar tissue? And that led to the spending of over $150 million trying to identify the pathways of activity. Now, the veterinary business would not support that sort of research activity, but human bladder cancer, is a multi-$100 million project. The rewards are very high and the competition is very fierce, but you get a lot of answers. So we ended up with a research group on the human side doing a lot of the work with human tumors, and then we would just take the human data and translate it to the veterinary applications. BCG has a lot of side effects. When you put BCG in the human bladder, BCG was actually made from the organism that causes tuberculosis in cows. They didn't even use the human tuberculosis, they used the cow one, which will cause tuberculosis in humans. Just a side thing, one of the reasons why we developed the method of pasteurizing milk back in the early 1900s was because children were drinking milk from cows that had tuberculosis and were getting tuberculosis. And so pasteurization of milk was to eradicate the bacteria that caused tuberculosis, which was present in milk from these cows. Now, when you put live bacteria in your bladder, you're actually inducing a bladder infection. And if you've ever had a bladder infection, they are very nasty, they're very difficult to treat. And this one particularly is difficult to treat because the bacteria that are proliferating in your bladder are bacteria that cause tuberculosis, and they are very difficult to treat with antibiotics. So you have to use very specific antibiotics. So if you're treated for bladder cancer and the infection in the bladder gets out of control, they have to use anti-tuberculin or anti-tuberculosis antibiotics to treat your bladder infection. Those antibiotics tend to be immunosuppressive. So while the bacteria is growing and stimulating immune response, and you have to kill it, then you're using anti-tuberculin drugs which actually suppress your immune system, and the tumors often come back. It's a sort of a one-way street. It's just a difficult thing to do. Also, the comments from bladder cancer patients today who are still being treated with that bacteria, many times they will say, the treatment side effects are worse than having bladder cancer. I think I'd be happy just to live with the bladder cancer and take my chances rather than use this very side effect prone treatment of BCG into my bladder. So our objective in those days was to see if we could replace that harmful bacteria treatment with our product, which is bacteria that are grown. We harvest the bacteria, we break the bacteria up in little pieces, which inactivates the bacteria, and you end up with these little pieces of bacteria are the active ingredient. And interestingly enough, when you put that in a human bladder, you don't see the side effects, you don't induce an infection. And all the bladder cancer treatments, many of which are chemotherapies, which are very irritating, our product had virtually no discernible side effects. It was very well tolerated in all the studies we did with the bladder cancer product. So as we learned more about how the product worked in human medicine, we would adapt it to vet. And one of the early discoveries in the mid-90s was where one of the technicians had been growing bladder cancer cells actually in a flask, so artificially growing the cells that cause bladder cancer. They're alive and well, and you've got to keep them, giving them nutrients out of the media that you grow them in. One of our research staff actually made a mistake, and they actually put the product in with the bladder cancer cells, and the cells started to die. If you've got an immunomodulator or immune stimulant and you're using the immune system to kill cancer cells growing in a flask do not have an immune system. So then we thought, maybe one of the excipients that we use to grow these cells is toxic, and maybe the toxic effect when we put the product in by mistake was killing the bladder cancer cells. So we then got very purified. There were no excipients, there were no preservatives. We put the two together, and again, the bladder cancer cells were dying. That led to a whole discovery about the mode of action of the product. So just to go back to the cell of this family of bacteria have some unique properties. And within that cell wall, so the wall that holds the cells together, are 4 very well characterized immunomodulators. And these had been identified in the early 1950s. And people were saying, well, there's a part of that cell wall is muramyl dipeptide. So somebody started to synthesize muramyl dipeptide as a cancer treatment because it was clear the wall of the cell was very potent. So that led to development of muramyl tripeptide. And muramyl tripeptide in Europe is probably the leading treatment now, experimental leading treatment for bone cancer in humans. It's not available in North America. So if you are a researcher in a university and you're working with bone cancer, either dog osteosarcoma or human, and you search the literature, you will be looking for muramyl tripeptide, and it's just not available. So what will come up in the literature search in the journals is that our product, Immunocidin for dogs with cancer, contains muramyl dipeptide. And muramyl dipeptide has a really potent effect on killing tumor cells due to osteosarcoma. We knew that, and we knew that long ago. But what intrigued us was what was killing the cells in the media. So what was the direct effect on cancer cells? And after about 2 years' work, the lab called us and said, we found out what is killing the cells in the flask, and it's the DNA and the RNA of the bacteria. And when we make this product, we try to preserve the RNA and the DNA. And that's part of our patent portfolio, particularly on the human side, was to gain an advantage. We were the first to describe that the DNA and the RNA were actually active. And actually, the DNA itself works like a chemotherapy. It will kill cancer cells on contact. And muramyl dipeptide, its role is to stimulate an immune response, which that immune response naturally will try to kill the cancer cells. The RNA are little tiny proteins that are present in all the cells. It's just in this particular bacteria, the way we make it, we actually encourage the growth of the DNA and the RNA. And when we chop the bacteria up, we very carefully take the nucleic acids, the DNA and RNA, and we wrap them around the little pieces of chopped up bacteria. So it's inactivated, it's not live, it can't grow, but we preserve those. So the little pieces of cell wall contain these 4 different immunomodulators, which are well described, and they in turn turn on the immune system that turns on an anti-cancer activity. But the DNA and the RNA, apart from helping stimulate the general immune response, actually can kill cancer cells. The second part of it was the FDA said, well, how do you know it's not just another chemotherapy? Because the downside of chemotherapy is it will kill the cancer cells, but it will kill any other fast-growing cell in the body. That's why cancer patients lose their hair follicles because they're fast-growing cells. They develop cardiac issues because the cells around the heart tend to be fast-growing. And that's why we have these long-term side effects with chemotherapy. But interestingly enough, when we grew normal bladder cancer cells in cell culture and added the DNA and the RNA, we had to go to a very high dose to get any damage done to the normal cells. So here we have a chemotherapy-like effect that has a really wide safety margin. That explains why when we found when we were injecting it into dogs with mammary tumors, the tumor would sort of explode. The tumor would grow, turn into a mini volcano, and would start to give off this exudate. And what we found was that exudate, it's a very nasty material. That is really just the tumor cells breaking down. When the tumor cells are all gone and the situation's normal, you'll see very little scar tissue. Whereas if you use chemotherapy will destroy the cancer cells, but it also destroys any other friendly cells that are growing at the same rate. On dogs, other animals, you end up with big scars when you use chemotherapy, where the tissue has been damaged by the chemotherapy. The nature of the DNA is that it will destroy tumor cells with a much earlier signaling pathway than chemotherapy. So the other thing we don't see is we haven't seen resistance developing to immunotherapy, and particularly the DNA and the RNA. It seems you can go back and hopefully you're getting, because of the combination of active ingredients, having these immunomodulators and this killing effect, you're setting up the immune system to recognize that cancer cell as a nasty invader. And so you get a memory on that cancer cell. So if you've got a dog with any type of tumor that's been treated for with our product, you tend to find that once you've got the tumor under control, the tumor can be treated again if it happens to come back, but they tend not to come back. Your immune system has a memory to that particular type of cancer cell. It got approved in the USA before Canada. And then we looked at other tumors that might be accessible, because at that point in time, we had no idea about being able to use it systemically. That wasn't in our thought process, because the human bladder is like it's like a balloon. And the tumors are growing on the surface of that balloon. Mammary tumors are in the mammary gland of the dogs and they tend to be external. And skin tumor in a horse, which we also have approval for, sort of lumps on the skin, very worrying. They tend not to be fatal. There are certain types of skin tumors in humans and dogs and cats and horses, which are very nasty and can be fatal. And we can talk about that in a little bit. When you're injecting into the tumor, you're killing off the tumor cells inside the tumor, and really explained well what we were seeing in the dog and the horse with response. As we got further along on the bladder cancer development, we started to look at other opportunities beyond bladder cancer. And one of the things that we were getting feedback from the veterinary side, with veterinarians telling us that they were seeing interesting effects in young animals that sort of gave us the impression that these young animals were getting an immune stimulation. So we were doing a study in baby calves. They're brought into a farmyard and there's adult cattle around, a lot of bacteria around, and cows don't use toilets and they certainly don't flush. The flush in a farmyard is the farmer going through with a hose, washing the manure away, but these baby calves are exposed to a lot of bacteria. So we were running a study on another product, and we said, let's see what this product does if we inject it into the calves when they look like they're getting a bacterial infection. And we did. We gave it to them intravenously. The calves that got this product just thrived. They didn't look back, and we, in fact, in that study, we used that product intravenously, and these calves that got the product just blossomed. They had no sign of bacterial infection, even though the time to use it was when they were showing the first signs of being sick. So you didn't use it till they looked like they're going to get sick, and it just stopped the infection in its tracks. So that gave us an exciting bit of news to work on. One of the first dogs to be used, a dog that my family had, it was a boxer. She was 8 years old and she developed a mammary tumor. She was an intact boxer. She developed a very large mammary tumor. We decided not to inject her into the tumor, which was our label claim, and we gave her a dose intravenously. Then we monitored her carefully. She got a second dose sometime later, about 3 or 4 months later, and she never received another treatment. And when she died of kidney failure, when she was about 13, we had to have her put down. The vet who had treated her the first time was the vet who looked after her passing. And he called me to say, oh, by the way, I did take out the mammary tumor and you should have a look at it. And he had it in a glass of alcohol in his clinic, in this glass jar. And the tumor was about the size of a golf ball, and it was totally necrotic. It had just died off, and it was totally inert. It had no blood vessels joining it to her system, and tumors thrive on blood supply. Then we realized that one of the modes of action is one of the cytokines that we measure is interleukin 12. And interleukin 12 is often called the anti-cancer cytokine. And what interleukin 12 does is it shuts off the blood supply to tumors. So that explained why tumor responded over a period of time and ended up being inert because it had no blood supply, and tumors need blood supply to live. So that tumor had been in her body for probably 6 years from the time of the mammary tumor's first diagnosis to when she passed, and we took out the mammary tumor, and it was just like a golf ball. It did sort of melt away. The tumor was very, very palpable. You could feel it. When she went into a heat cycle, it would blow up to about the size of not quite a baseball. But then it developed like a comet's tail down the mammary tissue, which was the tumor was breaking up and the body was resorbing the gunk, as Jennifer calls it, that was coming out of the tumor was being resorbed. And when we first felt it, and I took it to the local vet, and he was feeling the mammary tissue, it felt like a comet's tail right down the mammary gland. The one tumor at the top, and then this swollen tissue down the mammary gland. So he took a biopsy. All it was inflamed tissue. It wasn't tumor at all. So the body was resorbing it through the lymphatic system, didn't come to the exterior at all. It didn't burst out. It was draining internally. She lived 6 years. And when she died, her kidneys were failing, totally unrelated to the mammary tumor. So it's been an interesting learning experience. And that's where we got our courage up to say, well, if we give it intravenously in cattle, and we also use it intravenously in the horse, why can't we use it intravenously in dogs? And so Dr. Jeanette Kelly in New Mexico, did that first study with a lot of dogs, different cancers, different size dogs. And she did a safety study showing, to be sure, we dilute it in a little 150 mils of saline, and then the vets give it slowly by intravenous injection, and we've had no side effect at all. It's a very safe way to give it. And the good thing is, while the vet is usually doing that IV, they fuss around the dog after they got the IV started, and you get a little extra diagnosis time. You know, they'll check the ears, they'll palpate the mammary glands, they'll listen with a stethoscope while the dog is getting the product. So it's actually not a bad thing to take that time. You get a little extra vet time with your dog. Intratumoral certainly works very well for mammary tumors, but giving an intratumoral injection requires a degree of skill set from the veterinarian's viewpoint, in that we call it infiltrate the tumor. So you're trying to put a syringe into a tumor, and then you sort of push the needle to as close to the edge, the far edge of the tumor as you can get. Then as you withdraw the syringe, you press down on the plunger, and the idea is to leave a track of Immunocidin through the tumor. So it's fairly diverse. Then you do another track, then you do another track. Some vets are really, really good, and they get really good tumor coverage. The tumor reacts accordingly. Other vets have not yet mastered the technique. And so you might get a good track through part of the tumor, and that tumor will sort of collapse down, but they missed another big chunk which continues to grow. So we then said, what if we gave it IV? Because that would give a more systemic effect. So it's really dependent on who the vet is, how skilled they are, how big is the dog, how big is the tumor, how prominent is the tumor, how accessible is the tumor. If you're going intratumorally, you like to give it about every 2 weeks. But sometimes if you've got a tumor that's pretty nasty and they get very sensitive, and if you've got a good reaction in the tumor will actually swell up and become fairly tender and painful. And so sometimes in 2 weeks, you look at it, you can see the tumor reacting, and you say, you know, I better give it another week or two. Intravenously, we say to people with difficult tumors, why don't you give the first dose into the tumor, but then come back in 2 weeks and give the second dose intravenously, and then the third dose 2 weeks after that back into the tumor when things are sort of settled. Depends on the type of tumor, type of dog. The demeanor of the dog is really important. Some dogs are very tolerant. Some dogs are not tolerant. You want to have adequate pain control. Some dogs need more pain control than others. You don't want the dog to go through any sort of side effects or discomfort if you can avoid it. You get a local side effect. When you go IV, the side effects are minimal. If you go to too high a dose, misestimated the weight of the dog and they give too much, it seems like Some dogs do have a reaction, and it may be related to the amount of tumor mass their body is trying to fight. That if you've got a very large tumor or a diverse tumor, they will react more. Their immune system will react more. Sometimes swelling, usually fever, and then often the dog will get very lethargic. We say to people, I was just thinking of a gal that used to work with us, had a beautiful dog, and this dog had had a series of events with tumors where they had treated the tumor before, it kept coming back, and it was a tumor on the elbow, the front elbow of the dog. When we got the biopsy done, it was a combination of mast cell tumor, spindle cell tumor, and I think it had some squamous cell carcinoma cells as well. So it's like a triple tumor on the front elbow of this dog. And the veterinarian, the dog was, I think, 8 or 9 years old, and the vet had said, we've been fighting this tumor for a few years. Maybe it's time for the dog to pass. Maybe it's time to say goodbye. This was a very typical family, no children. The dog was their child, and the dog had been suffering a little bit in that they had to build a little staircase for it to get up on their bed at night. It used to sleep on their bed. She begged for product, so we agreed with the vet that we would treat the dog intravenously and see what happened with the tumor. So it was on weekly intravenous treatments. And then after about 2 months or 3 months, one of our staff veterinarians was looking at the dog. They brought the dog into the office for show-off day, took one look at the office and was feeling the tumor and said, gee, that tumor is really getting big. Well, the tumor basically turned into Mount Vesuvius and erupted. And that was really a good sign. And the angriness went away. Yeah. And about maybe a month after that, the same vet said, I'm looking at that tumor. I can palpate it really easily. The dog's not in any discomfort at all. Why don't we see if we can remove the tumor? And so I think by then it was about 3 months or 4 months into the treatment. And the local vet did the surgery, and one of our vets attended the surgery. And they said it was like peeling an orange, taking that tumor out. It had virtually no blood vessel attachment. It was getting to be the point of inert. And they took the tumor out. They said to the owner and the family, come and pick the dog up and we'll help you carry the dog from the kennel into the back of your truck. When they went to get the dog jumped out of the kennel itself onto the ground, raced across to the truck, jumped up into the truck. When we first gave the first dose, we said, be careful, she'll probably be very sleepy. And we forgot to tell her that she may run a fever. Well, that puppy ran a fever that night, and she and her husband were sitting up with water, giving the dog lots of water and trying to settle it down. And they were honestly worried. And we had forgotten to say, watch out for, you may get a spike in fever. Yeah. And they finally went to sleep. When they woke up in the morning, the dog was not in bed with them, and they thought, oh, maybe she's gone away to die. That was their first reaction, because dogs tend to want to do that when their time comes. They want to be isolated. So anyway, they looked around the house, and there's the dog standing downstairs over the food bowl, ate a full meal. They let the dog outside, and this puppy, it's now a puppy again, is chasing squirrels in the yard. And they would come in every couple of days. The family, the gal worked for us, she'd come in and say, today we took skidooing. And this dog would be there with goggles on and a bandana, sitting on the front of this skidoo, racing around the Bay of Quinte. They also used to like to go fishing, and they always did catch and release. So they'd catch a fish, put it on the ground. The dog would pick up the fish, put the fish back in the water. And they said, you've given us our puppy back. At the same time, the tumor came out as we anticipated. And that dog lived, I think, another 4 or 5 months. Then it suffered some cardiac event. It was very quick. They woke up in the night. The dog had some event going on unrelated to the cancer. It passed very, very quickly. But the word was, thank you for giving us back our puppy for a period of time.